Over the last day, Russia has announced nearly 10,000 new COVID-19 infections.
A new global virus doesn't just threaten health, it threatens entire nations. Some countries are more prepared than others, but a few stand at far greater risk due to their size, healthcare systems, and global connections. In this video, we'll uncover the top 7 countries most at risk from the new global virus, and why they could become the epicenters of the next outbreak. 1. India. India, with its population of more than 1.4 billion, is one of the most vulnerable countries when it comes to the spread of a new global virus. The sheer density of people in megacities like Delhi, Mumbai, and Kolkata creates the perfect environment for rapid transmission. Public transportation systems, bustling markets, and tightly packed living spaces make social distancing nearly impossible. Moreover, the country's high pollution levels and widespread health conditions, such as diabetes and respiratory illnesses, increase the population's susceptibility to severe outcomes if the virus spreads. Another major concern is the uneven quality of healthcare across the nation. While India has world-class hospitals in metropolitan areas, much of the rural population lacks access to proper medical facilities and advanced treatment. This imbalance could overwhelm the healthcare system quickly if cases surge beyond control. With millions of people living below the poverty line and limited healthcare infrastructure in many states, India faces a dangerous combination of factors that make it one of the top countries at risk. 2. China. China remains highly vulnerable to the spread of a new global virus due to its massive population and the density of its urban centers. Cities like Beijing, Shanghai, and Guangzhou are global business and travel hubs, welcoming millions of domestic and international travelers each year. This heavy movement of people makes China especially susceptible to rapid virus transmission. Industrial areas and crowded residential zones further create environments where controlling an outbreak can become extremely challenging. At the same time, China's strength lies in its ability to enforce strict health measures, as seen during past outbreaks. However, even with advanced healthcare facilities in major cities, rural and less developed regions often lack proper medical infrastructure. With over 1 billion people to protect, managing testing, treatment, and vaccination on such a large scale becomes an enormous challenge. This combination of global interconnectedness and uneven healthcare access puts China at serious risk in the face of a new global virus. 3. Brazil. Brazil faces a high level of risk from a new global virus due to its large and diverse population spread across vast regions. Major cities like Sao Paulo and Rio de Janeiro are densely populated, with crowded neighborhoods and favelas where social distancing and hygiene practices are extremely difficult to maintain. These urban conditions create ideal environments for rapid virus transmission. Adding to the challenge, Brazil is also a major hub for international tourism and trade, increasing the chances of the virus entering and spreading quickly. Another factor is the country's public healthcare system, which has been historically under strain. While Brazil has some excellent medical facilities, access to them is unequal, especially for poorer communities and those living in remote areas. During health crises, hospitals often face shortages of equipment, beds, and medical staff, making it difficult to cope with large-scale outbreaks. This combination of dense urban living, economic inequality, and limited healthcare capacity places Brazil among the most at-risk nations. For United States. The United States is one of the most globally connected countries, with hundreds of international flights arriving and departing daily. This heavy movement of people makes it highly exposed to the introduction and rapid spread of new viruses. Large urban centers like New York, Los Angeles, and Chicago are particularly at risk due to their dense populations and international links. Additionally, factors such as high rates of chronic conditions, like obesity, diabetes, and heart disease, make large portions of the population more vulnerable to severe illness once a virus begins to spread. While the U.S. has some of the most advanced hospitals and medical technology in the world, its healthcare system is highly unequal. Millions of Americans struggle to afford basic medical care or lack insurance altogether, which can delay testing and treatment. This disparity creates a situation where outbreaks can spread faster, especially in underserved communities. Combined with the country's political divisions and varying state-level responses to health crises, the United States remains at significant risk during a new global virus outbreak. 5. Nigeria. Nigeria, as Africa's most populous country, faces major risks if a new global virus spreads. Lagos, its largest city, is one of the fastest-growing urban centers in the world, with millions of people living in highly congested areas. Crowded housing, busy markets, and heavy reliance on public transportation create conditions where viruses can spread extremely quickly. With international airports connecting Nigeria to many parts of the world, the risk of imported cases sparking widespread outbreaks is very high. The country's healthcare system poses another serious challenge. While Nigeria has skilled medical professionals, the overall system is underfunded and struggles with shortages of equipment, testing facilities, and hospital capacity. In rural areas, access to healthcare can be extremely limited, meaning infections could go undetected for long periods. Public awareness campaigns and resources are often stretched thin, making it harder to contain outbreaks once they start. These factors combine to make Nigeria one of the most vulnerable nations in the face of a new global virus. 6. Indonesia. Indonesia, the world's fourth most populous country, is particularly vulnerable to the spread of a new global virus due to its vast population of over 270 million people scattered across more than 17,000 islands. Major cities such as Jakarta and Surabaya are densely populated, with crowded streets, packed public transport, and high levels of pollution that contribute to respiratory health problems. These conditions create an environment where a virus could spread quickly and overwhelm urban health systems. Additionally, the country's role as a regional travel hub increases the chances of the virus entering and spreading widely. Healthcare access in Indonesia is highly uneven, with well-equipped hospitals available in big cities but limited facilities in rural and remote islands. In many areas, medical staff, equipment, and testing capacity are insufficient to handle a sudden surge of cases. This geographic challenge makes it difficult to distribute vaccines, medicines, and emergency supplies rapidly across the country. The combination of high population density, limited healthcare infrastructure, and logistical barriers puts Indonesia at great risk if a global virus emerges. 7. Russia. Russia, the largest country in the world by land area, faces unique risks in dealing with a new global virus. Major urban centers such as Moscow and St. Petersburg are highly connected to international travel routes, making them potential hotspots for viral entry and rapid spread. These cities are densely populated, with millions of daily commuters using public transportation, which increases the likelihood of widespread transmission. The cold climate in much of Russia also contributes to longer indoor gatherings during winter, creating conditions where viruses can thrive and spread more easily. Outside of its major cities, Russia's vast rural regions present a different but equally serious challenge. Many small towns and remote communities lack sufficient healthcare infrastructure, modern hospitals, or trained medical staff. Reaching these areas with testing, vaccines, and treatments during an outbreak can be extremely difficult due to distance and harsh weather conditions. This uneven distribution of healthcare resources, combined with international exposure through trade and travel, makes Russia one of the countries most at risk in a new global pandemic. The truth is, no matter how advanced or prepared a nation may seem, a global virus knows no borders. These 7 countries face the greatest risk, but in reality, the safety of one depends on the safety of all. The question isn't just which country is most vulnerable, it's whether the world is truly ready to stand together against the next global health crisis. Because when the next outbreak arrives, humanity's response will decide the outcome.